few days, we thought it would be helpful to gather today, in particular, to share our current state of affairs one day after the state's... We thought it would be helpful to gather together today to share our current state of affairs one day after the state's vaccine requirements for healthcare workers took effect. And I should say what we're talking about is healthcare workers who have received at least one vaccine. If you have Johnson & Johnson as your vaccine, then obviously you are done after one. If you have received either Pfizer or Moderna, we're talking about having received at least one of the 2 shots in the series. Before I get into the details, here's the most important thing for all of us here on this campus. Albany Med will do everything it can to maintain our critical services throughout this staffing crisis. And as I've said many times, it truly is a crisis. There's no 2 ways about that. Let me also begin by recognizing and thanking Governor Hochul, who yesterday declared it as a crisis and also issued an executive order last night. I know you are all aware of that, and we truly appreciate the steps that she took to help with the current crisis. Our situation on this campus is not unlike other healthcare providers, and in fact, it really is like all other businesses everywhere in the United States. However, our situation is particularly unique. Albany Med's position in this community is unique because we take a very different role in the care that we provide, and we take that very seriously. We are the region's only Level 1 trauma center. Level 1 is the highest designation you can have as a trauma center. We are the only one designated with that within 25 counties. We are the area's only children's hospital. We are the area's only Level 4 neonatal intensive care unit. Again, that is the highest designation you can have. And there are other things that I can point out that are services that are unique that we provide. We also perform the most advanced procedures in this region. Now, I'm not saying that to be boastful by any means. I say that to underscore the notion that people rely on Albany Medical Center when they need a higher level of care, when they need us most. We know that, and we are steadfastly committed to upholding the trust in our community places in us every day. And when you look at the number of patient visits, more than 1 million times each year people seek our care. We care for the most vulnerable, and that is why we endorsed the vaccine mandate. In point of fact, Albany Medical Center announced on August 4th this year that we would in fact have a vaccine mandate on this campus. Since the beginning, especially given our position as the lead in the Capital Region Vaccine Network, we have followed the science, and we have said many times the vaccine is safe and it is effective. Even with the variant strains of COVID-19, the vaccine limits the possibility of serious illness, and we've seen that with our own numbers here on this campus. This morning I was looking at our numbers inside the medical center. We currently have 37 people in the hospital currently with COVID. That breakdown is a couple different ways. We have 35 adults and we have 2 children. We also have 25 on the floor and we have 12 in the ICU. 4 of those are on ventilators. In the last week, we've had 26 people admitted to the hospital with COVID. Of those, 81% were unvaccinated. And every single person who is on a ventilator or recently came off a ventilator here at Albany Medical Center is unvaccinated. So again, we believe that the science tells us that the vaccine is safe and effective and does protect us against all strains, including the Delta. For that reason, we have encouraged everyone to get the vaccine for themselves, for their families, and for the community. Healthcare workers are the heart of our community. Albany Med is the region's largest employer, so the health of our workforce is very much connected to the health of our region and our community. Our colleagues, my colleagues, have led with strength, passion, and dedication to overcome this health crisis. We can continue to do so by leading by example, and I applaud all my fellow caregivers at Albany Med and all the other regional hospitals with whom we speak to on a regular basis who have stepped up to be vaccinated, and they did the right thing. Because of the trust our patients have placed in us, we have a responsibility to be vaccinated. The vaccine requirements only exacerbate a staffing crisis which has been going on for quite some time And in point of fact, we knew this was going to be happening, and we opened up our incident command even a couple weeks ago to address this crisis. Before today, 98% of Albany Med's healthcare workers chose to get vaccinated. I'm happy to say that the Capital Region average for healthcare workers is 91%. Data from the Empire Center reveals that the vaccination rate among hospital workers is highest in the Capital Region than any other region in New York State. The statewide average is 84%. So we're very proud of the Capital Region, and we're obviously particularly proud of what's happening here on this campus. What that means today is that at Albany Medical Center, 204 of our workers, we have 11,456 employees, 204 of our healthcare workers are unvaccinated. We know this is a very personal choice, and we respect that, but safety is our top priority. These employees have been noticed that they will be suspended without pay for 7 days, and then if they do not get the vaccine, they would have to exit the organization. And I would say that 204 includes nurses, it includes people who work in IT, it includes people who are in clinical settings and non-clinical settings, and we're certainly happy to speak about that more if you would like. If an employee has one shot of the two-shot series, they will need to get that second shot when the manufacturer recommends it, depending on if it's Pfizer or if it's Moderna. If they do not get the second shot, they will also at that time be placed on the 7-day unpaid leave, and they would also have to exit the organization if they did not comply. We have communicated this to our entire workforce multiple times, and we've done so broadly. I think it's a true statement that we will not likely feel the full impact of what is happening with the vaccine mandate until next week. We have many different shifts. We run 24 hours a day, 7 days a week. We have employees who are on vacation. We have employees who are on leave of absence. We have some individuals who may have been unvaccinated yesterday who chose to get vaccinated, and they have not scheduled for a shift today, so we may not have that information. So this is a fluid number, and it will take us a couple days to sort out that number. I hope you can understand that. I also want to convey that this is a much bigger issue. We knew this was coming 2 months ago, and we knew it was coming, in fact, years ago. And when I say it, I'm talking about the staffing crisis that we're facing today. And because of that, the team at Albany Medical Center has been developing thoughtful solutions to our challenges. In point of fact, Dr. Masarway and I just left Incident Command. It's something that we've opened up now for the last 4 weeks. We run it on a regular basis, and it's all of the leadership in the medical center that is thinking about creative ways to deal with the staffing crisis in both clinical and non-clinical locations. One of the areas that we are heavily focused on and will continue to do so is recruitment and retention. We have a broad multimedia campaign. We believe that we need to inspire new colleagues to join our mission. Personally, I'm a 25-year emergency room doctor, and I can tell you firsthand, it is a great mission. It's something that we all feel very proud to be part of, those who are able to have the privilege of working in healthcare and have the privilege of working here at Albany Medical Center. Every day, we are changing lives and giving people hope, and I cannot think of a higher calling. Specifically, for recruitment and retention, I should mention, here at Albany Medical Center, we're doing several things. Let me just name a few of them. We've adjusted wages for almost half of our employees mid-year. We did that this summer in recognition that we needed to stay current with market rates. We are offering a $1,000 bonus to nurses who refer new nurses who will then stay here and work with us for a year, and $500 to employees who refer a new staff member to support services and the physician group team. I should mention that often when people talk about the staffing crisis, they think about nurses first. But in point of fact, the staffing crisis is much deeper and broader than just nurses. It's easy to focus on nurses, but we need everybody to be part of our mission, clinical and non-clinical, and that includes people who transport the patients, who draw the lab tests, who do the imaging, who help us with food preparation, etc. We are rewarding select employees with up to $250 per pay period if they have perfect attendance in that 2-week period, because we know how hard they're working without giving up, and they're staying here with us during this critical time. That is an investment of $1 million per pay period that Albany Medical Center is making on part of our workforce. Actually, to take it even to another level, when we look back over the last 2 years, we have invested $50 million in our workforce programs. That may obviously be recognized as a monetary figure, but what it does represent is how much we believe in our workforce and that they are our most important asset. It is only because of our colleagues that we can care for the patients. I would be remiss not to acknowledge that they have all been here working alongside us since the beginning of the pandemic in March 2020. Our population is aging. More people need good health care. We are honored to deliver it, but we need people to provide face-to-face care to meet the demand, and even telehealth when it is appropriate. It takes a lot of unique talent to make healthcare organizations operate well, as we do here on this campus. It's not just about doctors and nurses. We have IT, support services, human resources. We have to fill every conceivable shift, and we have to do it 24/7. So we are recruiting from a diverse talent pool out there. Our nursing professionals are aging. There are studies out there that show that the nursing workforce is aging, and we need to backfill those positions. We need to inspire a new generation to follow in the footsteps of those exemplary caregivers who are here today. The governor, with her executive order yesterday, took some bold steps that recognize nurses who can come from out of state with licensure from other states to practice in New York State. We applaud that. We need additional things in the licensure process that will accelerate and get more nurses back to the bedside. We need to think creatively. We have asked on this campus non-clinical members of our workforce to consider what role they may play in the healthcare delivery inside this organization. Think about this. We have patients who are currently in hospital beds. Some of those patients are on what are called a safety protocol. These are patients who sometimes are confused. These are patients sometimes who are at risk of perhaps getting out of bed. They need to be redirected. You do not need to have an RN license or a physician in order to sit there and help redirect that patient. What you need is some training that we can provide to anybody who can then act in the role of helping as a safety companion. That role, historically on this campus, was provided by someone called a patient care associate, someone who, if they weren't doing that, would be at the bedside helping the nurse doing other types of clinical duties. We have reached out to our workforce and we have said, would you be willing to volunteer? Would you be willing to come and do an extra shift, even 4 hours, to be trained as someone who could do a safety protocol sit? This is an example of many that we're thinking about creatively so that we can free up our work that needs to be redirected back to the bedside by those who can do it, such as patient care associates. Today, I'm taking this opportunity to call on our lawmakers to allocate the resources we need to care for our community and support decisions that give healthcare providers what they need to perform services our patients need. It is unclear right now when we will have to cancel elective surgeries. That, I'm sure, is something that all of you are thinking about and asking about. We're taking a very close look at that, and we're going to have to make those decisions probably in the days and weeks ahead. In addition to that, we may need to look at whether or not there are outpatient clinic locations that we would either need to reduce the number of hours or collapse down and redeploy that staff back here to the bedside. I hope we don't have to do all those things, but we might need to because safety is our top priority. We have to balance what we can offer with how safely we can do it and what only we can do in the region. As the safety net hospital for smaller community hospitals, we accept 16,000 transfers every year from hospitals in our outlying sections of the capital region and beyond. And this is something that I have been involved with now for over 10 years at the medical center. And for the first time that I can remember, we're having serious conversations about whether or not we will be able to say yes to all the patients' transfer requests that we get here to this campus. Again, I would underscore that we have unique services that we provide, so we must preserve the resources we have to care for those things that only we can do. Think about trauma, think about pediatrics, think about some of the higher-end surgical procedures that are only done on this campus. And this is a decision that we're making on a day-to-day basis. As I said earlier, this is a crisis, and certainly we hope that by sharing our story with you today, it will shed some light on the critical issues of our community's health. Before I open up to questions, I would like to say this, and sincerely I would say thank you to every single Albany Med employee who has battled the pandemic, and even before that, gone above and beyond to keep our region healthy. Your work has healed the bodies and hearts of countless people. The pandemic and the crisis only underscored it. And with that, I'm happy to answer any questions.
In addition to and aside from the vaccination being incentivized by not getting patients sick, would you say there's an additional moral imperative when it comes to not exacerbating the existing staffing crisis when it comes to the individual employee?
I don't think I'm going to draw a moral conclusion, but what I'll say is this. We all go into healthcare for a reason. We go in because we want to make people better. And the truth of the matter is, Darrell, is that a lot of people have worked very hard over the last 18 months in the pandemic, and some people have given their full effort and they're tired and they need a break. So some people have chosen to leave healthcare because they're retiring or they're moving on to something that they find less stressful. We totally understand that. For those that are choosing to stay at the bedside and care for patients, Albany Medical Center has always had a position, even predating COVID, that vaccine is something that we think is safe and something that's effective. For example, 2 years ago on this campus, I believe we were the first hospital in the Capital Region to mandate the influenza vaccine. We went through a similar process then where people said it was their personal choice. At the time, I think we had a handful of individuals who chose to leave at the time. And what we learned then and what we're learning now is that at the end of the day, if someone chooses to leave healthcare because they don't want to get a vaccine, our job then is to do the best job we can to care for the people who present with the staff we have left and recruit new people to come in.
Does the hospital have a position on religious exemptions?
Right now, New York State has said that there's a federal judge that said that you cannot prohibit people based on religious exemption. So Albany Medical Center and all hospitals in the state are currently accepting religious exemptions, and we're pending any final decision on that until the final ruling comes out. So to answer your question specifically, there are people currently working here today at Albany Medical Center who are unvaccinated who have asked for a religious exemption. Similarly, we have people who have asked for that who have a medical exemption. Those individuals will be masked, of course, in all clinical settings, and they will undergo the weekly testing to be sure that they don't have COVID. And when there's a final decision on the religious exemption, Albany Med and other area hospitals will go back and revisit that issue.
And how difficult, if at all, will it be to integrate National Guard members or out-of-state healthcare workers if you do need them to fill the 204 positions?
The out-of-state is easier. Out-of-state is something where we did that in the first part of the pandemic. We had nurses who came from out-of-state who are licensed to practice medicine in other states who came here in a traveler position. That happens with some frequency. In point of fact, we did that during the labor action in December of last year. National Guard is not something we've ever done in the past. Obviously, if that's something that we need to do, we'll figure out how to do it at the time. We've talked internally on this campus about what those moments would be, what those triggers would be, when we might have to ask for that help. We're not at that point yet, but that's why we have incident command to figure that out.
And just to be clear, the 204 does not include the ones with the religious and medical exemptions, correct?
That is correct. The 204 today, and I would remind us again, that number is fluid. Whatever number I give you right now might be different in 3 hours. But that 204 are people who have been noticed that they are not compliant with our vaccine requirements on this campus and are put on an unpaid leave for 7 days. And at the end of that 7 days, if unvaccinated, would therefore exit the organization. So by definition, those 204 have not sought or been granted either a medical or religious exemption.
How many religious exemption employees are pending at this time because of that temporary restraining order?
I'm going to get you that number. It's a relatively low number, and honestly, before we leave today, I'm happy to get you that number. I just don't have it off the top of my head, but it's a low number.
When did that clock begin for the 7-day suspension with no pay? When did that clock begin for those 204 employees?
That will begin on Friday.
This upcoming Friday.
And we set that date before the state set their date.
Since you made the announcement in early August, how many employees have left because of that mandate here at Albany Med?
We do know that 25 nurses have chose to leave the organization because of the vaccine mandate. So when I talk about the numbers that are currently in that 204, that does not include some that have already left. The total number is a number that I don't know, but I do know the number of nurses was 25.
So the employees that have left over the last month and a half, those are not factored into this 98% of healthcare workers.
That is correct.
So it could be lower in terms of...
I want to emphasize that 98% is a number, though, that we are very proud of. Even if you factor in the people who have already left, with 11,000 employees, our overall workforce vaccination rate is in the high 90s. We do know that's certainly higher than the Capital Region number. It's higher than the state number. In fact, I was on the phone with the governor before I got here. She called just to check and see how things were on this campus. I mentioned that we were at 98% vaccine before yesterday, and she thought that number was a number that was something we should be very proud of, and I agree.
You mentioned that you commended the governor's executive order for changing license requirements, but you also mentioned there more could be done. What else would help address this problem?
There's a lot of things that could be done. One of the things might be scope of practice. When you think about, for example, the work that an LPN can do versus what an RN can do, we believe that the work that an LPN could do could include a more robust admission assessment or discharge education. These are things that would free the nurses up, the registered nurses up, to do more things that only they can do. That's one example. Certainly, when you look at what hospitals are paid for the care they deliver, Albany Medical Center has a lower Medicare wage index than other hospitals that are similar that we compare ourselves to. And that's true not only for Albany Medical Center, but other hospitals in the region, because the Medicare wage index is a regional number. If our Medicare wage index was higher, in turn, we would have higher reimbursement for our Medicare patients that we see, and in turn would allow us to invest more of that money back into our workforce. Certainly, we're advocating for no cuts to Medicaid. It's obviously a pay program for the care that we provide that is very critical, and 70% of the people who we care for are governmental, whether it be Medicare or Medicaid. So we're always advocating to not have any cuts in those programs. Those are some of other things that could also be done.
And given Albany Med's position on upstate and the Level 1 Trauma Center, have you had these discussions with the Hochul administration or anyone there?
We've been on the phone with representatives from her administration now for several weeks. We've been very fortunate. We have a weekly, sometimes biweekly phone call with all the area hospitals where we check in. That started back in March of 2020 for COVID. It continued for the last year and a half. Over the last 3 weeks, it's pivoted to be more of a conversation about the staffing crisis, which all of us are facing. We've been very fortunate to have on that call representatives from Governor Hochul's administration.
And is it possible to get a breakdown of that 204 employees?
So I can give you a breakdown. I can tell you that of the 204, 48 of those are nurses, 29 of those are patient care associates. I can tell you that we do have, by last count, and this number might change, we had 10 physicians on that list, and we had 6 students. I could give you other numbers, but those are some of the higher order numbers. Again, I would caution us, those numbers may change. In point of fact, some of those people yesterday might have gotten vaccinated and not turned in their paperwork yet. Some of them might be on vacation, some of them might be on a leave of absence, but those are the numbers we had yesterday. And those are the individuals that we've noticed.
Okay. What exactly qualifies for a religious exemption, and what is the approval process for it?
Albany Medical Center's process is similar to other hospitals in the region. There are 2 things you need. First is that you need to have a personally held belief that you can articulate in a letter to the committee seeking a religious exemption, and then you need to have a letter of support from a faith-based leader in that religion. And what I can tell you is that we have a multidisciplinary process here that looks at each of those cases. That includes a representative from our bioethics department here at Albany Medical Center. It includes someone from pastoral care. It includes someone from our clinical teams and nursing and risk management. So we have several people looking at that request.
When it comes to elective surgeries, would you prefer to be in the position you're in now, where it's up to the hospital on whether or not to cancel them, as opposed to last year when you had essentially no control?
I would prefer to be in neither. I would prefer, and that's the honest answer. I think that both of them are difficult positions to be in. We want to be able to run every OR that we have for every patient who needs our services. And what we need is we need to make sure that we have enough staff to do all of those things. Certainly, if you're directed to shut down ORs, there's a reaction to that that's negative. When you have to make the decision yourself, you seem to have a little bit more control, but it doesn't make the situation any better. The one thing that we do know is that once we get through the vaccine mandate period and we know what our final number is, then we know what our need is to backfill those people who have left, and we're going to work very hard with our retention and our recruitment efforts to get those folks here.
In a more general sense, where are things trending with the Delta variant?
As you know, cases that come into Albany Medical Center that are COVID, a sample of those are sent over to the Wadsworth lab. Not every positive case, but certain ones that when you run the lab test, the results come back quicker, that have the higher likelihood of being a variant. And of the samples that we've sent over to the Wadsworth lab recently, every single variant that we have is the Delta variant. What I can't tell you, and what no hospital can tell you, is what percentage of the patients who come in have the Delta variant, because we're not sending all the samples over there.
So is it safe to say that things are improving? Are they getting worse? Where are things right now?
From a COVID standpoint right now, I would describe the situation on this campus as plateaued. The numbers I gave you, again, in the last 7 days, we had 26 people admitted to the hospital with COVID, and we had 27 who left the hospital. So we actually came down by 1. When you look at the graph for the capital region, what you can see is that the number in the capital region came up and it's plateaued for the last couple weeks. That number, I think, is running in the 150 to 160 range. Personally, I'm very happy to see that number not continuing to go up, and I'm cautiously optimistic that as we get more people vaccinated, we're going to see that number even come down.
Now, as you mentioned, it's not just nurses and physicians that you're talking about when it comes to staffing shortages. Are you seeing a staffing struggle when it comes to transportation?
Yes. We rely on transporters to move patients around. That's a perfect example of where healthcare is competing with other non-healthcare entities to recruit the same possible employee. If you're somebody who's a transporter here, we obviously like those individuals because we know that they come in, they believe in our mission. Many of those transporters go on to become a transporter, they become a patient care associate, maybe they go on to become a EKG tech or a nurse or work in our OR as a surgical tech. So we see that as a position that allows them to move up. But some of them may choose, if they didn't want to be vaccinated, to work in a business in the region where the vaccine is not mandated. So that is a real challenge that we have. Fortunately, I think the overwhelming majority of our transporters have chosen to be vaccinated.
You said Albany Med has not yet had to cancel any electives, but I'm curious if on the regional calls that you have with the other hospitals, have any of them mentioned that they've needed to suspend those yet?
I think that we're all in the same place. All organizations are looking at their elective schedules. Obviously, cases for surgery are booked a week or sometimes multiple weeks in advance. So we know that we currently have the staff to care for those that are already on the schedule. What's likely to be the challenge will be going out into next week and beyond. So there's a meeting actually today on this campus where all of the chiefs of surgery for all of the different departments, our nursing leadership, our hospital director, Dr. Venditti, are going to sit down and look at next week's schedule. Allow me, if you would, to describe the flow of patients in the hospital. You have 3 different ways in which people can come into the hospital to be admitted, to occupy a bed upstairs. You have people who come in through the emergency department. You have people who are electively either having a surgery or some type of procedure who then need to spend the night or multiple nights, and you have transfers into the hospital. What Albany Medical Center is doing now is the complex math of figuring out what we can staff, what historically comes in through the emergency department, what historically comes in the form of transfers, and then how many people we can do procedures on who will then end up staying in the hospital. What complicates this, and this is really a very important issue, is that when people leave the hospital, they go to a couple different locations. They go home, they go to rehab, or they go to some type of skilled nursing facility like a nursing home. As you know, nursing homes are having issues with their own staff and trying to get them vaccinated. And I'm very encouraged by some of the numbers I read today that they're cresting over 90%. But if nursing homes are required to close beds, and we're unable to move people out of the hospital into the nursing home, and if that continues to grow over the next days to weeks, then you're going to have a situation where hospitals are congested, where we have to very seriously consider those portals of entry. So you can't stop people coming through the emergency department, nor do we want to. So then you only have 2 choices. One choice is to limit the number of people who have procedures that are going to end up in beds, or you limit the number of transfers that come into that hospital. There are hospitals in this region that are not generally in the business of taking transfers, but as I said, we are. Last year, we took 16,000 transfers into this hospital, of which 10,000 became admissions. That's a significant number of the people who are in this hospital. So we have to look at all those things, Bethany. We have to look at the OR, we have to look at the cath lab, we have to look at the transfers, and make sure that we are providing safe care by looking at the numbers that are in the hospital beds.
Have you heard back from any of the nursing homes when attempting to discharge patients that they don't have the room?
Yes, we are on daily phone calls with, I would say, every different nursing home in the region. Our director of case management speaks to them every day. At our daily safety brief, we talk about how many people we currently have in the hospital that are waiting to leave to go to a nursing home. Today, that number is 25, and we're going to watch that very carefully over the next days to weeks to see if that number increases. We speak to them. As you know, one of the issues which is challenging, with discharging to a nursing home is, do they have the right skill set in that nursing home? Do they have the right equipment? Is it, closely located to where the patient's family is? These are all factors. But one of the barriers often has been the prior authorization to get somebody into a nursing home. And with the executive order, that was lifted, so that's helpful.
I know right now you're focused primarily on getting people vaccinated the first time, but where are you on booster shots? The governor had a press conference yesterday explaining who would be qualified for those. How necessary are those at this moment?
It's a great question. We obviously know that at this point, the recommendation is that the booster shot is approved for Pfizer. We've not yet heard about that for Moderna or for Johnson & Johnson. We do know that the booster shot, for those over 65, they should get the booster. That's the recommendation. And for those that are essential workers, they may get the booster. Here on this campus, we have not yet operationalized doing booster shots on a large scale yet because we have a lot of members of our workforce who got Moderna and got Johnson & Johnson. But we're actively talking about that. And in point of fact, Lisa and I were at a meeting before we came here where that was one of the topics. So we'll probably talk more about that in the weeks ahead.
And when I spoke to Dr. Sanders last month, he said that we should expect some variation of maybe an annual.
And that's certainly been our experience with influenza. I think those of us who work in healthcare, an annual flu shot is something that we just consider to be part of our normal health maintenance. It's what we think that we need to do to work in a hospital, to have the privilege of taking care of patients. We want to be safe. We want our patients to be safe. We get our annual flu shot. I don't see the COVID as being any different.
Just to follow up on an earlier question, we confirmed about the religious exemptions.
Thank you.
We're currently holding on 29 right now, so 29 out of more than 11,000 is a small number.
And that is the number I remembered, but I thank you for making sure we had it exactly right.
Was that religious and medical exemptions?
That was just religious exemptions.
And if you would like that number, I'm sure we can get that as well. Everybody is busily tweeting. That's good. We want to get the information out. Are there any other questions that I can answer? And I'm certainly happy to stay down here and do any individual ones as well.
As far as you know, does NISNA have a position on this as far as the vaccine mandate?
My understanding, and Dr. Masarwe can correct me if I'm wrong, is that the New York State Nurses Association has come out in opposition to mandatory vaccines.
Will that actually affect hospital operations at all?
No. Obviously, we put into place the fact that we were going to have a vaccine mandate on August 4th. We know the state came out after that as well and had a similar position. So that's what we're going to follow. I will take this opportunity to say, Darrell, that we understand that the staffing crisis is something that requires all of us to address. And we are actively looking for opportunities working with the New York State Nurses Association here on this campus to find creative ways to work together to address the staffing crisis. So we have regular meetings with them. We are in conversation with them. We've put forward some things that we think would help, including the PEP program, and we would encourage them to work with us on the staffing crisis, which is certainly structurally much more complex than the COVID epidemic was on this campus, and it's going to last longer, and we're going to need their partnership going forward to address that.
Well, having just resolved a years-long negotiation, I guess you could call it, is the tension back now because of the disagreement positionally?
I personally don't feel that tension. Obviously, we have our positions, they have their positions, but on this particular issue, I think that we should agree that we should work together to address the staffing crisis. Okay, I'll conclude then by saying to those who are here, thank you very much for the opportunity to put our story out, and I'm happy to stay around and answer any other questions. Okay, thank you. And Dr. Masarway is here as well.
I was wondering if I could grab these. Make sure everyone's been on.